Hello, I'm Mohit.
Hello, I am Hardik.
How are you?
I am good. How are you?
Yes, I'm good. And today we're going to discuss a little bit about public health and especially the social perspectives of public health.
Okay, yeah, I am going to discuss about a research paper about gender disadvantages and reproductive health risk factor for common mental disorder in women.
Okay, so what's the aim of your study?
To determine the association of factors indicative of gender disadvantage and reproductive health with the risk of common mental disorder in women.
Okay. So, can you please explain a little bit?
The study of cross-sectional survey was conducted in Goa from November 1, 2001 to June 15, 2003.
Okay, and what's the population size?
3,000 women were randomly selected keeping in mind the eligibility criteria, age, residence for 12 months not being pregnant.
And how's the data is being collected?
Data collection considered of two mandatory requirements for participation, example face-to-face interview and collection of biological sample, blood sample, vaginal and urine specimens.
Okay, and what's the gender disadvantage?
A state in which access to rights or opportunities is offered by gender.
Okay, can you please explain about the reproductive health?
Reproductive health is defined as a state of physical, mental and social well-being in all matters relating to reproductive system at all stages of life.
And what are the common mental disorders, CMDs, basically?
CMD refers to a wide range of mental health condition disorders that affect your mood, thinking and behavior. Examples of mental illness include depression, anxiety disorders, eating disorders and addictive behaviors. Many people have mental health concerns from time to time. Common mental disorders interlink to reproductive health risk factors, social economic risk factors and gender disadvantage risk factors.
Okay, and can you please highlight the key terms that is being related to the inequality and social disparity?
The first one is gender, second one is economic status, third one is marital status and lastly social status.
Okay, so I would like to highlight the strengths of the research.
Relatively high participation rates despite invasive nature of investigation, use of standardized, validated field tester method for diagnosis, use of indicator of economic, reproductive health and gender disadvantage, which are culturally and ethically appropriate and validated, use of biological indicator of reproductive health exposure. Definition of all reproductive symptoms were derived from recent guidelines for reproductive health research. The study was very well planned, organized and conducted, that too in multi-language to enable maximum participation.
Okay, that's good. And what about the limitations of this research?
Sampling bias because of non-participants who were eligible for the study, which were hypothesized indicative of gender disadvantage due to lack of education or permission given by family to participate in the study. Bias due to lack of finding as some interviewers carried out interviews.
Okay, so can you please enlighten the facts and figures of the research?
The prevalence rate report in this study was lower than that reported from studies in developed countries such as United States and United Kingdom. One out of 5 women have experimented for that sexual violence since the age of 15.
Okay, so at last, I will ask you that what you can conclude from this research.
From this research, we can conclude that the clinical assessment of CMD in women must include exploration of violence and gender disadvantages. Gynecological symptoms may be somatic equivalent of CMD in Asian women.
Okay. And what about the references that you has used?
References, here I can describe you as given below.
Okay.